So how and when to use the medications. So some of these things are things that you can pick up over the counter. So Gas X obviously you can get anywhere. Again, pretty much safe to use anytime. So if you're used to feeling your rabbit, they feel a little gurgly, a little bloated, kind of blah, then a couple of doses of simethicone, like 1/2 ml to 1 ml, not gonna hurt anything. So if you come in and are like, I already gave it simethicone, okay, great. So Reglan and Cisapride, some of you that own especially multiple rabbits and have been through multiple bouts of stasis or have elderly rabbits that are kind of on chronic intermittent medication, Reglan and Cisapride generally also always safe to use in these guys. Never really hurts to give a couple doses of Reglan or Cisapride. The only caveat to that is, so in veterinary medicine, in veterinary school and pharmacology, we were taught that because it's a propulsive medication, so because it makes that GI tract start moving along and gets peristalsis back to normal, potentially, if there's an obstruction and you have a strong peristaltic wave, you could rupture the GI tract. I have never seen that happen in any species, and I've used it in horses, rabbits, chinchillas, guinea pigs, rats, cats, dogs. I've never seen that happen, but it is a possibility. So you do have to kind of use it just a little bit with caution, just to be aware of. But usually in your, average size rabbit, 1/2 ml to 1 ml is a pretty safe dose. So the Laxatone, again, so the hairball paste, pretty much always safe to use. You're not really going to do any damage with Laxatone. So, however, if they're not eating, generally they're not very inclined to lick a bunch of Laxatone off your finger either, especially if they're at the point where they're refusing their treats. Lactulose. Lactulose is usually safe to use as well unless you already have some soft stool. Then you do not want to give lactulose because then you will get a bunch of diarrhea all over the place, so which also does not help the GI tract. Pain medications, so the opioids, usually with most of the opioids, again, if this is something that you have at home already and have been advised by one of us on how to use it, usually low dose opioids are okay to start before you can get them into the vet. High dose opioids, you're gonna just whack them out and then they're really not gonna wanna eat. They're just gonna be laying there like bleh. So really, really high dose opioids do have really bad side effects. You can cause respiratory and cardiac depression. That would be really uncommon. A little more common with the injectable ones like the Hydro and the Bupe, but fairly uncommon to actually cause a problem with the opioids. NSAIDs, always call us first before you give a dose of NSAIDs, because I really hate when people come in and they're like, oh yeah, I already gave it Medicam, and we run blood work and the kidney values are like off the chart, and we're like, ugh. Hopefully we can get the kidneys working again now. So unless you know they're really well hydrated, I would, or it's something they've been on for a long time, then potentially you can still have problems, but then it's okay to give. But always call us and ask us. So, all right, antibiotics. So some of you are not gonna like this slide. As a general rule, do not ever start and stop antibiotics without consulting your veterinarian. So this is something that's done a lot, but as a general rule, you should never stop and start an antibiotic. We give antibiotics at a specific dose for a specific length of time based on the pharmacokinetic and dynamic information that is published for each species for that medication. We are seeing a lot of antibiotic resistance. As a general rule, most antibiotics are safe to give a dose to start them on. However, again, if we don't know what bacteria are causing the infection, then it's not going to do any good. You're going to build up resistance to that antibiotic, and then we're going to have less drugs that we can use in the future. There are a few like amikacin and gentamicin. If you have an animal that's dehydrated, you will kill its kidneys and we will not be able to get it out of kidney failure. So those are, that's kind of my soapbox. So antibiotics, generally you should not be starting and stopping them without consulting with one of us first. Dr. Camper's a little more lenient on if you call saying, okay, go ahead and start it, than I am, but as a general rule, do not stop and start antibiotics. Sub-Q fluids, again, usually okay to give a dose of sub-Q fluids. You notice your rabbit's a little bit off, seems a little bit uncomfortable, it is okay to give a dose of sub-Q fluids. One lower dose of sub-Q fluids or something we've given in the past is, even with a heart condition, is rarely going to do damage. So, and may help. Sometimes it's just a little dehydration. Maybe they got a little overheated. Maybe they feel a little crummy. They got a little bit of extra treats or something. Their GI tract now feels a little bleh, so they're not drinking as well. One dose of fluids or a couple doses of fluids are generally not going to cause an issue. So, and most of you have fluids and things like that at home or other meds, and you know your rabbits. So you know when they're feeling crummy, you know when, it's okay to give a dose of medication or fluids and when you need to bring them in.